My guest is an interdisciplinary leader with over 25 years of experience, bridging gaps across public health education, promotion, research, and policy in governmental, nonprofit, and academic settings. You're listening to the PHEC podcast, episode 411. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Now, you may be new to the podcast, or maybe you are a regular listener. I'm really glad that you're here. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations, community health foundations, and government agencies. We specialize in a variety of community assessments, helping our clients collect, analyze, manage, and communicate their data and health information in plain language to the communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we may be able to support your organization. The links will also be provided in the show notes. Now, I am excited, very excited to introduce you to my guest on this episode. Now, if you're a regular listener, you know that I say that all the time, but it's the truth. I get excited about every guest that's on this podcast. But the reason I'm, emphasizing it right now is because this is a local guest. It's really a treat to me when I can connect with someone in my local area. I live here in South Carolina, the southeastern part of the United States, and my guest is also from the same area. So I am really happy for you to get a chance to get to know her through our conversation as well. And let me just formally introduce her, and then I'll go ahead and connect our conversation. Dr. Megan Weis is the Director of Connecting Communities for the South Carolina Center for Rural and Primary Healthcare. She is a Master Certified Health Education Specialist with over 25 years of experience in public health education, promotion, research, and policy in governmental, nonprofit, and academic settings. Her work bridges practice and academia to unite non-traditional partners from various disciplines and organizations to jointly address public health and healthcare challenges at the community and state levels. She is a graduate of Furman University and received her graduate degrees from the Arnold School of Public Health at the University of South Carolina. Let's connect my conversation with Dr. Weis right now. Wonderful. Hi, Megan. How are you?
Hey, I'm doing great. It's so fun to be here.
I'm excited for this episode, our conversation. We've been chatting for a little while. I thought we need to go ahead and hit record and get going here. Why don't you just take a moment and introduce yourself to everyone?
Sure. I'm Dr. Megan Weis. I work at the Center for Rural and Primary Healthcare. I'm the Director of Connecting Communities and also have a research assistant professor with the School of Medicine. That's where we're based. My background in public health, about 25 years now. So I have experience in governmental public health, academic public health, starting a nonprofit and health policy, some global health there from Peace Corps. So really just a lot of different areas. But I guess I mainly would describe myself as a pracademic, because I really enjoy the academic work and being able to be on that side. But one of the things I enjoy most about public health is that translation of academia to practice, from academia to governmental public health and medicine, that intersection. So most of my career in some ways been part of that bridging and that collaborating and bringing together of non-traditional partners.
It's wonderful. You're talking my language there. I feel like sometimes there's a lot of power in this intersection, when you can bridge, healthcare, public health, and the different silos of public health, breaking those down and, like you're talking about, the academic, the practice, the policy, that's where that power really increases, especially when we're able to communicate that or relay that, put that into action and explain that to people so they're really informed and making decisions based on that information. So
Absolutely, absolutely. And being able to bring together all the lessons learned in the different areas, it's like anytime you have the diversity of thought and experience coming together, you can really make some of the better decisions and really have that positive impact.
this is wonderful. So, like, I tell people this often, I say this on the podcast, everyone listening, this is really a treat for me. I'm really getting to know you. You're my neighbor here, and I'm really genuinely excited. And our listeners just get to tune in and chime in and get to know you at the same time that I'm getting to know you. So, I love to ask this question. This is how we're going to kick off. Stepping back a little bit, and of course, this is a retrospective view, so it's great to hear it because now we've figured out a lot of things. Going through it at real time, we don't always see what's happening, what get the full lesson out of it. But kind of going back and reflecting over is a great way to revisit some of those moments, but also sharing the journey. So, I guess my first question is: when did you first hear about or become familiar with, or consider public health, become interested in public health?
Yeah. So for me, like a lot of people, there was a really influential professor in my life. So I had been a high school athlete, cross country, track, and I'd gone to school and Furman University. Got to put a shout out for the Paladins there, and running cross country and track, and they have an excellent exercise science program. So I was all exercise science all the way, human performance, all of that great stuff. And I took an elective called Health Promotion and Education by Dr. Silas Pierman. I want to say his name because I think it's always important for us to really honor those folks who've been amazing mentors and people in our life. But he taught that class, and I was like, oh, this stuff is cool. Because I just hadn't come across it at any point in time and didn't know it existed. And I was like, I really like this. So my interest was truly, really piqued. And that was my introduction. But then also I had the opportunity to do some exercise science research with him one summer. So I got some of that experience. And so I was trying to decide, for grad school, which way to go: exercise science, public health, what am I going to do? And I ended up, since I'd had the research experience, I ended up applying for the Peace Corps. And I was a maternal and child health volunteer in Malawi in sub-Saharan Africa. And he was a great supporter of that. And that really just kind of solidified, okay, this is my home. Health education, behavior, public health, the policies, all of this stuff coming together. But that initial spark and interest really was because of a professor who taught a really engaging, wonderful class. And then I'm privileged that he's became a mentor in college, and we remain in contact now to just a mentor throughout my career.
So I love hearing that, especially, well, kind of two parts here stand out for me. When you were saying, well, I took that one class, I was thinking to myself, that's how they get you.
That is how they get you.
You were that little introduction, because I think for a lot of us, it's like, it's a sense of what we want to do, but it doesn't click until we have that first class or that first experience with that information or that opportunity. It's like, oh yes, this is it. And we can label it. But the other thing that stood out as you were introducing yourself and I answering this question is speaking to your mentor. And you say it's important to mention their names. That is such an important thing to do. We don't often do that and reflect back and remember those mentors, because sometimes we have them for a season in our lives, and sometimes they're for the long haul. But it's important because they're just along the way pouring into us, and their reward is to know how that impacted us at some point. So just to be able to come back or to give them a shout out or to go back and say, you really introduced me to this and it helped me on this journey of my career to whatever, fill in the gaps. So I really appreciate that gesture and that sentiment. That's really important, I guess, for everyone listening too.
Yeah, no, thanks. And I think something that you just said, for the long haul or for a season, I think that's something also, reflecting on a career, which I am mid-career. I got a lot of career left, but I have been around long enough to, those inflection points of, oh, this ended up being a more monumental decision or an influence in my life than I thought at the time. But there are those mentors who, like for me with Dr. Pierman, who has been in for the long haul, other people important in my life. But then there are those people who come in just for a season or that pivotal moment with that sense of wisdom and grace that help you see something and maybe not there the long haul, but they're still there. And it's really interesting to me how people can have such an impact on your life, even if it's just for a short period of time. So I also try to remember that myself, like working with students and other things. You never know who's listening, what's going on, and all that with the interactions.
Yeah, yeah, so true. That's really fascinating start. Is there a particular population or condition or public health problem that you're most passionate about now?
Yeah, well, definitely rural health. I'm really glad that I found my way here to the center and focusing on rural health. It's interesting because lots of times I think public health in some spaces, it's like, okay, you're all cardiovascular disease or you're all diabetes, or, it's very subject specific, or it can be. And there's such a need for that, especially in research. But what I've tried to do is really think about like some of the skills and what we bring to the table, like with evaluation and policy and other areas. But then I have found with rural health being a passion area of mine for applying some of the skills and lessons learned along the way, because there is so much challenge, but there is also so much opportunity there, and so much of the policy and the work that we do really kind of geared more towards urban. Not discounting that at all, any way, shape, or form. I don't want to say that, but a one size fits all policy, blanket policy, can actually do harm. So really being able to think about that and working with the rural communities in different areas. So when I talk about rural, that can be increasing access for maternal and child health or chronic disease or other areas, but it's really ensuring that rural communities have the same opportunities to be as healthy as possible.
Extremely important. And of course, I get it. We live in a rural state, and there are
Mhm.
so many,
Absolutely. Yeah.
and having, before I moved here, I lived in the DC area. And so obvious differences down to some of the smallest nuances, like walkable neighborhoods. We don't really have sidewalks in our neighborhoods like we did back in Virginia, for example, in DC area. And, we're further away from grocery stores and just all of the things that some people that are in urban areas can walk to, or you have public transportation to get to. So there are a lot of things that, you know, we could we could spend a whole lot of time talking about all the things, but
We
yeah,
could.
but
Yeah,
definitely,
just structurally and even demographically, particularly in South Carolina, it's just different.
yeah, absolutely. Well, let's talk a little bit more about your current role. Tell me again what you do now, and let's kind of dive into that a bit.
Yeah, so I am the director of connecting communities at the Center for Rural and Primary Healthcare, and our center is a legislatively authorized center of excellence. And really, our mission is to accelerate the development of healthy rural communities. And overall, as a center, we really support improvements and initiatives for healthcare delivery, those connecting of the communities, workforce and training, and also research and evaluation. To date, a lot of my work has really focused on the public health side, so that connecting of the community. So, really, anything outside of the clinic walls. We do have aspects of our center and folks who work with and improving some of the delivery and what's going on in there, and also in workforce and training. So, it's really helping to build programs and perspectives where communities, community based organizations, where we're able to really look at those non medical drivers of health and help them be connected in different ways. So, for example, we've worked with a group called Healthy Learners, which is a 501(c)(3), and they do screenings of kids who their mission is to increase access to remove those health barriers to learning. So we've worked with them to expand to rural areas to increase screenings, not only screenings for things such as vision and hearing and dental and areas, but then if someone screens positive or might need additional care, they work to connect that child to care, and they also help with the transportation, which can often be an issue, and into those areas. So really, just from those aspects, also becoming much more involved in some of the policy work that we do, and thinking about how policy, either at the state and federal level, really affects rural health and rural health care and public health in those areas. So, and then also some of our communications, to start doing a little bit more of that too. So, being able to share the stories for rural and share the stories of the successes for improving health in rural in other areas.
Oh, okay. So now you're in my little area of interest, the communications. So what are some of the, if you're able to talk about it, what are some of the things that you're planning to do in terms of improving communications?
We're just working with the center internally for some of our communications and whatnot. So, yeah, stay tuned.
Yeah. All right. And that's a great example for with children and the screenings. Are there some more examples of the programs that you're implementing or that are targeting?
So our center doesn't as much go out and provide all of the healthcare. What we really do is we're able to work with those historic providers who are already in communities and working with the community. So both the healthcare and the community-based organizations, the community leaders, to really be able to amplify what's already working or to be able to try out new things to do that. So again, really appreciate the trust from the legislature to be able to do that in different areas. So we have programs all around strategic workforce and training. So there's a whole program around working with some of the historically Black colleges and universities around being able to train students and them also being able to work with folks within the community. We work with some research and evaluation and being able to provide evaluation for other folks and also put out some of our own research on what's going on. And yeah, we've also had some programs in the past working with libraries. So for like community health workers and social workers based within a library to connect with folks. We're really taking a look at what's worked and not worked there for some future directions, but really trying to be innovative. And I think one of the biggest keys that we have is that most folks working and living in rural know what they need. So again, working with those historic providers already doing work and really being able to amplify it and be able to help connect folks where they need to be connected.
Oh, that's wonderful. I really like that. And that is true. Most of these organizations, they've already done the work. They really know what they need. So I like that sometimes it's programs, but then a lot of times it's connecting resources, organizations or programs that are already working well with the organizations or communities that need, those resources. Really great. I could see that just kind of scanning through my mind some of what I'm familiar with in our own state, and I can see how that is working really well.
Yeah, and some other organizations, community paramedicine. Not sure if you're familiar with that, but really the idea that paramedics are able to provide some additional services, especially, I don't want to say downtime because they are always on call and always working really hard, but being able to take care of some of those different needs and areas with some home visits or follow up that helps prevent folks from them potentially needing to go to the emergency room later. Because as we all know, if you can catch things earlier, to bring that together. So there's a wonderful program in Fairfield that we work with for that. So overall, the center, we have about 75 active programs and cooperative agreements with folks. So we could probably go any direction and stay all day talking about some of the different things, but that's just a taste of some of the work.
Yeah. Well, that's really great to hear about some of the things that are happening in my own backyard. So it's really wonderful. How long have you been here in this work or in this organization?
Oh, so great story. My first day at the Center for Rural and Primary Healthcare was March 16th of 2020, which I will never forget because it was the first day of the
I
COVID
really remember
shutdown.
March of 2020. That was very significant for a
Yeah.
lot of us, but me especially.
Yeah, and I had joined here actually previously. I'd spent about 13 years with the Institute of Medicine and Public Health, which is another amazing 501(c)(3) in our state. I was the first full-time hire when it was just a grant coordinator and helped to be able to build that into the organization that it was when I left, and also it continues to be really influential and important in the state now. But I moved over to the center because I really wanted to be able to dive deeper and into the rural health work and be able to have some more connection with some of the community work and some of the other areas. And it was a new challenge and a wonderful thing to be able to do. So I've been here a little, I guess, coming on 5.5 years. And the center itself started in 2017 was the first time it was really in the legislative proviso as a center. There'd been a project, a keystone project that we have called iCare, that where we're able to help support specialty care in rural areas, bringing that there. And that remains a keystone program of the center to bring that there. And then that grew into the center as a center of excellence at the School of Medicine.
Yeah, that was for me, March of 2020 was when I first started consulting. I had my full-time job and I was consulting on the side, and my business grew had gone about as far as I could with that and decided to hire myself full-time. So I left my full-time job and turned all my equipment in. And that was March of 2020. And I was a full-time entrepreneur and then the whole world shut down. And it
It
was
was a
like,
time.
what?
It was a time. Yeah. Yeah, because I remember that Friday, I had a couple days off in between, positions. My son's birthday was March 15th, went from having a full-on birthday party for his 7th birthday to nothing,
Yeah.
and, talking to my boss, was like, "Well, the kids don't have school, I think I got it worked out," and then it's like, "Oh, okay, no, I'll see you in a couple weeks," and, obviously, we worked it out, and it was what it was, but, yeah, I'm not forgetting that start date. It was a time. That's all I can say about that. The center was wonderful and everyone I work with, but just what we all went through during that time period was rough.
But I know I can imagine, given your background to that point, you were really prepared to be able to do the things you needed to do to navigate that really difficult time because you already had a good amount of experience coming out of kind of academia and, that organization.
Yeah, I think as much as any of us did.
Yeah, right. We we pulled on our strengths that we didn't know we had at the time. But,
Absolutely.
this is really great. I would like to kind of move into maybe a little bit of just given the current climate of things. I mean, this is put into context. We're recording this in June of 2025. And since the beginning of this year, we've had so many shifts politically that have impacted just almost every area of business, especially public health. I don't know if that has been an impact for you and your organization or how it's affected you, or if there are other challenges that, you all are kind of maybe dealing with. But is there any particular challenge that you are addressing as an organization at this time that you could speak to? And then just kind of like, how are you doing that?
Yeah, well, I think when you have rapidly changing funding and policy environments, you always have to keep track of that. But what we do at the center and what we've always really been able to do is really focus on, we're working to improve rural health. The work that we do hasn't changed with that in any way, shape, or form. I know some of our partners have really been really impacted. So definitely being cognizant of everything that's going on and what different folks are dealing with in different areas, but we're really working and are in a space where we're able to really kind of continue on with what we're doing.
That's great. That's great to hear, especially again, living in this rural state and knowing that at least that's something that is continuing. So, of all the things that we hear about that's being cut and that's stopping, it's nice to hear that this is continuing, and that's great. Also, being aware of, like you said, some of the programs that have been impacted and being able to kind of make those updates and adjustments to the rural communities that you serve.
Yeah, definitely keeping track of that and where we can help or be able to be part of role. Things change so rapidly that it's hard to say very specifically where things are, but definitely aware of that. And, and like with the reconciliation package at the federal level, some of those different decisions could impact funding in different areas. So being aware, definitely being aware, but we've not needed to change really anything that we're able to do today.
That's good. Yeah, I put in context of how at the time of the recording, because so much, and I do this because I've been bringing this up on interviews and so much is changing so quickly. So I put everything in the context of at the time of this recording. So we have a lot of, probably a variety of people that listen to this podcast. We've got students, early career professionals, mid-late career professionals. We've got people who are niche, small community focused, and then we've got folks that are globally focused. And so there's just such a variety. If there's some bit of advice that you could share from your career experience or the work that you're doing now for anyone that may be interested or maybe similar type of work or stage of career, what would you could speak to the students, you can speak to whoever you'd like because we've got such a mix. I think whatever you share is gonna land on good ground. But is there any bit of advice career related that you would share with anyone at this time?
Yeah, sure. So, yeah, I saw this question on the pre-work and I was thinking about it. And I'm really going to come back to every now and again, I get to speak to some of our students in our public health leadership classes. So, some of the things that I share there that it seems some of them are lessons I've learned and some of them are lessons that I have to learn more than once. Sometimes things go along that way. But one is really being authentic to yourself, where you work, I think, and the work that you do. I think sometimes in our career paths, we can get caught up in, oh, I want this specific title, or I want to do this specific title, or this is the one role that I have to go for. And if I don't get to that pinnacle or that area, I haven't succeeded or I haven't made it. And I think really being able to see what it is that brings you joy and brings you passion and doing the work, something that I've always tried to do is focus on the work and the outcomes there. Of course, we all have ambition and we all want to make an impact. I'm not saying that there, but what I have found is that almost every job I've had in my career didn't exist or even before I got the job. So like with the Rural Center for Rural and Primary Healthcare, that's a position we created when I came over. So it wasn't like, oh, I want to do exactly that, but being able to be in work and be able to create that. When I joined the Institute of Medicine and Public Health, that was a new grant. It was a program coordinator. We built it along the way. So that's really what I'm saying is that there are so many opportunities to be able to build and craft in different areas. Sometimes also what I share with students is really focusing on building those skills. Like if you have a passion for evaluation and really bringing the data or the epidemiology to things, you can apply that in so many different areas to be able to bring that to it. And then the other part is just being open and going along. As I said, like I went into a class and I was like, oh, this is really great. Or I had an opportunity, or in grad school, I had a graduate assistantship at what is now the Department of Public Health in South Carolina. It was DHEC, so I apologize if I start mixing up acronyms as we talk. But it was in injury and violence and prevention, which I hadn't been a part of before, and I really found a lot of interest there, and that led to my first job out of the master's and some of the other areas. So it's kind of being open to things.
I think everything you said was excellent, and I actually agree with you. It's great advice and very relevant to hopefully, the people that are listening are writing that down. And if you have to rewind back and get it, I think all three of those points are very, very important. And you kind of demonstrated them through our conversation, really, examples of that. But great advice. I'm going to squeeze one more question in here before we wrap up. This is something that I work to do all the time because when I think of epidemiology and I spit it out there, most people are not going to know what I'm talking about. They may or may not have heard the word. So to kind of avoid the awkwardness, I started finding ways to explain it differently, and I almost gamify it in a sense, because I feel like if they don't understand it, then how are they going to even take advantage of that, either in terms of connecting me to someone else or opportunities, or taking advantage of something that I can help family and friends with. So my question for you is, how do you explain the importance of your work, what you do to and its connection to public health or epidemiology in conversations with your family, friends, community?
Yeah. So, at the base, what I really say a lot for work I do now is that I help people living in rural areas be as healthy as possible, have the chance to be as healthy as possible in different ways. And then, depending on who folks are, the questions they ask, my kids, they're 8 and 12, they're like, oh, okay. and they do that. But, other folks in the field can start talking more about when we really talk about policy and what's going on for different payment systems or at the federal level for different policies. This is how it can impact urban versus rural differently. So, for example, with the CDC, with the rural health equity grants that they had, there was a rural carve out, and that really helped ensure that a certain percentage of the funds went to rural areas. In the past, when the CDC had their community transformation grants, all the objectives were purely like a 5% change in obesity over 5 years, but it was so numbers based that for folks to really be able to meet the needs of the grants, by necessity, you had to hit as many people as you could as quickly as possible, which then left out some of the areas that maybe weren't as populated. So even how we would design granting and policy to different areas can really make an impact on people's health. So again, we were talking about communications and our shared love for that, talking with my peers, talking in general, people in rural areas living as healthy as possible, talking to another policymaker why it matters. It's like, well, no, yeah, it sounds great, but unless you really ensure that there's chances for everyone to be impacted, we can go there, different areas. So I guess that's the kind of the two extremes on that. But I guess at the basis, always trying to tell a story along with it to help explain it.
I love that. I absolutely agree with that, with what you're doing, because it's an approach that I use as well, and it's a clean, clear kind of explanation, and then it opens it up for the conversation. And like you said, you gave kind of two extremes in the example, but I think it's
definite
important.
extremes. One's very wonky.
Right. But I think that it's a great place to be, because then it opens it up for feedback. If they come back and ask a little bit more, like you said, if it's like, okay, I get it, they're good. They're like, I know what you do now, or there's no other follow-up, that's fine. But if they come back and start asking more questions, and you're you're positioned to go a little deeper. And I think that's great.
Yeah. And I think, when we talk about health and public health, everyone we know interacts with it. They might not know it, they might not realize it, but we all want to be as healthy as possible. So there's, that basis and that shared connection that you can always start with. And you can, expand upon that depending on the different interests.
Yeah. Oh, I love that. I'm glad I got a chance to squeeze that in because I love your answer to that question. Megan, this has been such a great conversation. I appreciate you making time to speak with me and to share about your journey and all the tips and insights that you kind of sprinkled through the conversation. It's been a lot of fun to get to know you, and I appreciate you.
Oh, thank you so much. I appreciated the invitation so much.
Awesome. Well, we're definitely going to keep in touch because you're right here.
Oh, absolutely. Absolutely. we already started making those plans.
That's right. All right. Thank you. I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Dr. Weis and learn more about the work that she's doing. And be sure to let her know that you heard her on this episode of the podcast. You can find the links to connect with her on the show notes page for this episode. This episode is episode 411, and you can find that at phecpodcast.com. Once you're there, just navigate to episode 411 to find the show notes. One more thing before we go. Remember that our podcast has a new app where we can continue conversations from episodes like this one with public health professionals from around the world. You can download the new PHEC Podcast Community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.